McNeill Hall's Simulation Learning Center is a 10,000 square foot state-of-the-art learning center that provides future practitioners with realistic simulation technology across specialties to prepare professionals for a 21st century practice. Students train in a challenging, safe environment and gain hands-on experience to develop confidence in the clinical setting. The Health Assessment Lab supports student learning of health assessment skills. It features 7 patient care units separated by privacy curtains, hospital beds, bedside cabinets, overbed tables, and wall-mounted diagnostic units. The lab also includes tables and chairs for lab activities and debriefing, and a monitor for streaming simulations. Students use the Acute Care Lab to learn basic to advanced patient care skills. The lab consists of 9 patient care units, including hospital beds, bedside cabinets, overbed tables, and are separated by privacy curtains. Features include Pyxis medication dispensing stations, patient lift systems, headwall units with medical gas outlets for simulated bedside oxygen, air, and suction, and a linen cart. It also includes tables and chairs for lab activities and debriefing, and a monitor for streaming simulations. Students learn complex and critical patient care skills and the implementation of high-fidelity simulations in the Critical Care Lab. This lab consists of 3 private patient rooms, each with AED trainers and a shared Pyxis medication dispensing system, medication cart, ventilator, and EKG monitor. Each patient room has an observation room. Students practice pediatric patients' care skills in addition to high-fidelity simulation in the pediatric lab. Features include an adolescent care unit, pediatric bed, crib, and wheelchair, a Broslow code cart, a pediatric digital scale and weight scale, and a medication cart. Headwall units with medical gas outlets simulate bedside oxygen, air, and suction. This lab also has an observation room. Students use the Maternal Infant Lab to learn patient care skills for the maternal and infant population, in addition to high-fidelity simulation. Features of this lab include 2 birthing patient care units, infant warmer, neonatal crib, and bassinets. Headwall units with medical gas outlets simulate bedside oxygen, air, and suction. This lab also has an observation room. Students practice and perform health assessments and physical exams on learning partners and/or real patients in the outpatient, clinical, and exam rooms. This lab features 2 adult and 1 pediatric exam rooms, including examination tables and stools, diagnostic units, microscopes, and sinks. A reception area complete with counter, computer, and chairs simulates patient intake and registration. The Home Care Lab provides students the opportunity to practice patient healthcare needs in a simulated home setting. This space features a living and dining area, bedroom with furniture, a fully functional kitchen, and a handicap-accessible bath. Faculty can watch simulations via the observation room. The Operating and Emergency Room Lab is designed for students to learn patient care provided in the OR and ER. The OR includes 1 operating table, dual head ceiling mounted surgical light, 2 instrument tables, Mayo stands, and kick buckets. An anteroom with pass-through cabinets and a knee-operated sink replicate an operated room. This lab can be converted to an emergency room and has an observation room.